Hello, this is Mary Corcoran, and I'd like to use this video to introduce the PhD in Translational Health Sciences. In this presentation, I'll provide an introduction to the need for the program, an overview of the curriculum, a description of who might be interested in enrolling in the program, and some information about the PhD faculty. A PhD of this type has been of interest in health sciences for a very long time. We began to talk about a PhD in 2007 when the health science programs became part of the Clinical and Translational Science Institute at the Children's National Health System. In November of 2013, we formed a planning committee. The Council of Doctoral Studies accepted our proposal in May of 2015, and the Board of Trustees approved our proposal in June of 2015. I'd like to talk a little bit about the gap which is addressed by this PhD program. You can pick up a newspaper on just about any given day, and it's likely to contain examples of difficult health-related issues demanding immediate attention. These range from global outbreaks of virulent infectious diseases to escalating incidents of chronic conditions such as diabetes or obesity. Although there may be existing evidence about what should be done to address these conditions, our knowledge may be limited about how the existing evidence can be implemented where and when it is needed. Even when the health issues being addressed are not making headlines, widespread translation and implementation of evidence-based practices is slow and uneven. It is estimated that the time between evidence generation and its implementation in practice can be as long as 20 years, and patients in the United States only receive about 50% of the evidence-based recommended care available. In response to this translation gap, a 2014 report by the Institute of Medicine called for a seamless integration of clinical practice and research in support of accelerated evidence generation and a need to advance implementation science. More than ever before, today's healthcare providers and healthcare leaders are faced with complex challenges to translating evidence to practice that requires navigating geographical, organizational, economic, cultural, and professional barriers. These challenges are formidable and multifaceted, so the solutions must be robust, comprehensive, and draw on cross-disciplinary knowledge representative of multiple and novel perspectives. The translational spectrum is used to illustrate how discoveries move from bench to bedside. Our program focus is translation from human clinical trials to widespread practice and beyond to affect the health of populations through policies which are based on empirical data. The PhD in Translational Health Sciences has adopted this graphic to illustrate the framework for the program. In order to create new knowledge about innovative and effective practices and research methods, a foundation is established consisting of collaboration science, implementation science, and translational research. Collaboration science involves complex problem solving by incorporating the unique perspectives and knowledge of a range of stakeholders. Implementation science, also known as implementation and dissemination science, examines the processes and strategies influencing the movement of evidence to practice. Translational research requires conceptualizing evidence as a continuum of knowledge and discovery from basic science to public health. The 52-credit curriculum is organized in 3 units plus an elective, and those 3 units reflect the framework that I just showed you in the last slide. PhD students are required to conduct original research, which is reflected in the 28 credits devoted to research and research methodology. We anticipate that the didactic portion of the curriculum will require 2 years. At the end of year 2, students will have passed 2 comprehensive exams and defended their dissertation proposal. They will then be ready to engage in mentored research to complete their dissertation. Our cohort-based program uses a blended format. This involves students in a cycle of reading, reflecting, applying, interacting, synthesizing, integrating, and ultimately generating new knowledge. Some of these aspects of the blended learning cycle happen online and some happen in a face-to-face meeting. The face-to-face portion of the curriculum takes place over 2 long weekends each semester. In between those on-campus meetings, students work with their instructors online. The online portion and the face-to-face portion are optimally and purposefully designed as a spiral of learning with new learning scaffolding on what was learned previously. We plan to enroll between 10 to 15 new PhD students as a cohort each year. We anticipate that interested applicants will include healthcare providers, professionals in a range of educational roles, healthcare or research administrators, and public health professionals. We are drawing broadly from across George Washington University, the School of Medicine and Health Sciences, and Children's National Health System to engage scientists, educators, and practitioners in one or more of 3 potential roles: that of advisor, mentor, or instructor. The advisor has a critical role in this program. The advisor is assigned to students before the interview or even shortly thereafter. The advisor works to connect the student with possible mentors and eventually plays an instrumental part in choosing the dissertation committee. Mentors may offer anything from short-term to long-term research immersions or specific guidance about questions or problems encountered along the way. The dissertation committee may be comprised of individuals occupying the role of an advisor or a mentor or an individual in the larger community of scholars. Our website is coming soon and it should be up by the end of July. In the meanwhile, feel free to contact me with any questions or to be put on our email distribution list. Thank you very much.